The most painful diseases in human history. Part 2. Trigeminal neuralgia. Trigeminal neuralgia is often described as one of the most intense pains a human can experience. Many doctors call it the suicide disease because of how unbearable the pain can become. Cause. The most common cause is compression of the trigeminal nerve by a blood vessel. Less commonly, it can be caused by multiple sclerosis, tumors, or nerve damage after injury or surgery. Transmission mechanism. This condition is not infectious. The trigeminal nerve carries sensation from the face to the brain. When the nerve becomes irritated or compressed, it begins to fire pain signals incorrectly. Normal sensations like touch, chewing, speaking, or even a light breeze can trigger explosive pain. Symptoms: pain. The pain is sudden, electric, stabbing, and shock-like. It usually affects one side of the face, often the jaw, cheek, or around the eye. Attacks can last seconds to minutes, but may repeat dozens or hundreds of times a day. Many patients live in constant fear of the next attack. Eating, brushing teeth, shaving, or smiling can become terrifying. Impact. Quality of life collapses. Weight loss, depression, and social isolation are common. Some patients avoid speaking or eating entirely. Today, medications that stabilize nerve activity can help, but many patients require surgical procedures to relieve nerve compression. Early diagnosis is critical. Complex regional pain syndrome. Complex regional pain syndrome is a condition where pain completely disconnects from the original injury. Cause. CRPS often begins after a fracture, surgery, sprain, or even a minor injury. The exact cause is unclear, but it involves abnormal responses in the nervous system and immune system. Transmission mechanism, not contagious. After injury, the brain and nerves fail to turn off pain signals. Inflammation, nerve hypersensitivity, and abnormal blood flow combine to amplify pain far beyond what the injury should cause. Symptoms: pain. The pain is constant, burning, crushing, and deep. It can feel like the limb is on fire or being crushed from the inside. The affected area may become swollen, red or blue, hot or cold. Skin can become shiny and thin. Even light touch can feel unbearable. Over time, muscles weaken and joints stiffen. Impact. CRPS can spread beyond the original injury site. Many patients lose function of the limb. Depression, anxiety, and disability are common. Today, early treatment offers the best chance of improvement. Physical therapy, pain management, nerve blocks, and psychological support are essential. There is no single cure. Avascular necrosis. Avascular necrosis is pain caused by bone death. Cause. The condition occurs when blood supply to a bone is disrupted. Causes include trauma, long-term steroid use, alcohol abuse, sickle cell disease, and blood clotting disorders. Transmission mechanism not infectious. Without blood, bone tissue dies. The bone weakens and eventually collapses, destroying the joint surface. Symptoms: pain. Pain begins as a deep ache, usually in the hip, knee, shoulder, or ankle. At first, it occurs only with movement. As the disease progresses, pain becomes constant, even at rest. Walking becomes painful. Eventually, the joint collapses, causing severe mechanical pain with every step. Impact. Mobility declines rapidly. Many patients require joint replacement at a young age. Chronic pain and loss of independence are common. Today, early stages may be managed with medications and reduced weight bearing. Advanced disease almost always requires surgery, including joint replacement. Postherpetic neuralgia. Postherpetic neuralgia is what happens when shingles pain never stops. Cause. It is caused by damage to nerves from the varicella zoster virus after a shingles outbreak. Transmission mechanism. Not contagious once shingles resolves. The virus permanently injures sensory nerves. These damaged nerves continue sending pain signals long after the skin heals. Symptoms: Pain. Pain is burning, stabbing, electric and hypersensitive. Even light clothing or a breeze can trigger agony. The pain follows the original shingles pattern along a nerve pathway. It can last months, years, or even a lifetime. Impact. Sleep is disrupted. Depression is common. Elderly patients are especially vulnerable. Facial involvement can be devastating. Today, early antiviral treatment during shingles reduces risk. Pain management often requires multiple medications. Vaccination dramatically lowers incidence. Pancreatic cancer pain. Pancreatic cancer pain is often deep, relentless, and difficult to control. Cause. The pain comes from tumor growth invading nerves, organs, and surrounding tissues. Transmission. Mechanism. Not infectious. The pancreas lies deep in the abdomen, close to major nerve plexuses. Tumor pressure and inflammation irritate these nerves. Symptoms. Pain. Pain is deep, gnawing, and radiates to the back. It often worsens after eating or lying down. As disease progresses, pain becomes constant and severe. Impact. Quality of life declines rapidly. Appetite, sleep, and mobility are affected. Emotional suffering is profound. Today, pain control requires aggressive multimodal treatment, medications, nerve blocks, radiation, and palliative care. Early pain management improves dignity and comfort. Sickle cell pain crisis. A sickle cell crisis is among the most severe pain experiences in medicine. Cause. The disease is genetic, caused by abnormal hemoglobin. Transmission. Mechanism. Not infectious. Red blood cells become rigid and sickle-shaped, blocking blood flow in small vessels. This causes tissue ischemia and inflammation. Symptoms. Pain. Pain is sudden, severe, and deep. It can affect bones, chest, abdomen, and joints. Patients describe it as crushing, stabbing, or throbbing. Attacks can last hours to weeks. Impact. Repeated crises lead to organ damage, chronic pain, and reduced life expectancy. Children and adults live with constant fear of the next episode. Today, hydration, pain control, oxygen, and disease-modifying therapies are critical. New treatments and gene therapies offer hope. Endometriosis. Endometriosis pain is often invisible but devastating. Cause. Endometrial-like tissue grows outside the uterus, often on ovaries, bowel, bladder, and pelvic nerves. Transmission. Mechanism. Not infectious. The tissue responds to hormonal cycles, causing inflammation, scarring, and nerve irritation. Symptoms. Pain. Pain is deep, cramping, stabbing, and persistent. It worsens during menstruation, but can become constant. Pain during intercourse, bowel movements, or urination is common. Impact. Many patients are dismissed for years. Chronic pain affects work, relationships, fertility, and mental health. Today, management includes hormonal therapy, pain control, and surgery in severe cases. Early recognition is essential. Bone metastases. Bone metastasis pain is one of the most intense cancer-related pains. Cause. Cancer spreads to bone from organs like breast, prostate, or lung. Transmission. Mechanism. Not infectious. Tumors destroy bone structure and activate pain receptors while weakening skeletal integrity. Symptoms. Pain. Pain is deep, constant, and worsens with movement. Fractures can occur with minimal trauma. Night pain is common and severe. Impact. Mobility declines. Fractures and spinal compression can cause paralysis. Pain significantly affects quality of life. Today, treatment includes radiation, medications, bone-stabilizing drugs, and advanced pain management techniques.